On Daybreak, health experts say asthma is often going undertreated and underdiagnosed in older adults.
It can lead to sleep problems, emergency room visits, heart issues in some cases. Nina Criscolo is on the story this morning. A few perspectives through the hours. At this point, writing it off as something completely different seems to be all too common.
Absolutely. And you know, we're all familiar with asthma, right? The condition can inflame the lungs, make it difficult to breathe. Older adults, though, often just think it's a sinus issue or maybe even that they're out of shape. But ignoring those signs could be dangerous. Estimates vary, but up to 9% of older adults are thought to have asthma. One medical journal says half of those have not been accurately diagnosed. Studies show death rates for seniors with asthma are 5 times that of younger patients, and medical complications are more common. Our bodies are less able to deal with asthma symptoms as we age, and compromised vision, fine motor coordination, and cognition can even make it more difficult to use an inhaler correctly. And that's just for those who know they have asthma. We spoke to a otolaryngologist at IU Health who says there's no risk in asking your doctor about the possibility of asthma, and the test is really simple.
The doctor will use a small machine to have you take deep breath in and blow out as hard as you can over about a second. And they'll test that volume of air that you can press out to tell if that's within the normal range or if it's a little lower than it should be. And then they can give you medicines to see if it improves that breathing.
Dr. Alyssa Illing says some asthma patients may have felt better over time or stopped filling their inhaler prescription because of the cost. Research does show older adults tend to prioritize other medical conditions over asthma, underestimating the impact it can have. If you are one of those experiencing symptoms, you should talk to your doctor.
Talking about older Americans and maybe discounting this, we think of it, not everybody, but a lot of families, for instance, think of it as a kiddo's disease, and that's where the focus is.
Yeah, absolutely. But kids have a lot of opportunities for asthma flare-ups. We don't have as many of those as adults, but symptoms can develop even in your 70s and 80s. Wow. So think about it if you're having your chest tighten up, difficulty breathing, even wheezing while doing common activities like vacuuming, shopping, walking. Those are signs that you should talk to your doctor right away.
Yeah, and don't just brush it off as allergies all the time.
Or even that you're out of shape. It could really be asthma.
Okay.
Thanks, Nina.
Let's